Hello, everyone. I can see that people are starting to join the webinar. Thank you so much and welcome. We'll just give people a couple of minutes to make their way in, and we'll get started in a couple of minutes' time. Wonderful. I think we can get started. So, hello, everyone. Thank you so much for joining us this morning, afternoon, or evening, whatever time it is where you are. We're delighted to have you with us for what we hope will be a really interesting and wide-ranging discussion on how longevity and climate change intersect and what we need to be doing differently to tackle these two global megatrends. First, I will say a little bit about who we are and why we're here. My name is Esther. I'm the Senior Health Policy Lead at the International Longevity Centre in the UK, or ILC, one of 16 ILCs around the world. Together, these ILCs are the ILC Global Alliance, a network of organisations all working on different aspects of longer lives and what they mean for society. I'm chairing this webinar in my capacity as co-chair of the ILC Global Alliance Climate Change Committee, a role that I share with my colleague Paul. The committee aims to spark debate, build networks, and suggest solutions for dealing with the two key phenomena of our times, the climate crisis and demographic change. Why is this work needed? Because the World Health Organization projects that by 2050, the world's population of people aged 60 years or older will reach 2.1 billion, double what it was in 2020. Also by 2050, the World Economic Forum predicts that the climate crisis could cause an additional 14.5 million deaths, $12.5 trillion in economic losses, and $1.1 trillion in extra costs to healthcare systems around the globe. Our thesis is that you cannot speak about longevity without climate, and you cannot speak about climate without longevity. We must be talking about both and following that talk with urgent action. We do not feel this is controversial, but we see very little happening in public policy on either of these issues around the world, let alone both together. So why this inertia on two transformative global issues? For one, we know that many of our policy-making systems around the world are not set up to tackle long-term issues that do not fit into a short 4 to 6 year political cycle. One of the things that is missing here is the structural capacity for long-term decision-making and action. Another is the political will to do anything about it. So we have convened this webinar to hear from some brilliant experts about how we can tie longevity and climate action together in people's minds. We also need to know how we can convene advocates working towards the same or similar goals, but perhaps in different silos. We know that climate and longevity experts tend to want the same things: safe, healthy, sustainable lives that are productive and work in tandem with our physical environment, not against it. So we're really delighted to hand over to our first speaker, Professor Carl Pillemer, who's going to say a little bit more about the role that older people are currently playing in this effort. If I could hand over to Carl. Sorry, Carl, I think you're on mute. And I didn't read out the introduction that I should have read out for you. I'm so sorry.
Well,
So I'll just
how many Zoom calls do we need to be on before we remember to unmute ourselves? It is just terrible. But I'm sorry. Go ahead and thanks for the introduction. Sorry.
I will properly introduce you. So Dr. Carl Pillamer is the Hazel E. Reed Professor of Human Development at Cornell University and Professor of Gerontology and Medicine at Weill Cornell Medicine. He is the founding director of the Cornell Institute for Translational Research on Aging, which is devoted to using research to improve the care and quality of life of vulnerable old people. Current projects examine the causes and consequences of environmental civic engagement and volunteerism amongst older people, with a focus on developing and evaluating new methods of training and recruiting retirees for environmental leadership and action. There we go, Carl. Over to you.
All righty. Thanks a million. Yes, so it's a pleasure to be able to talk about this because I think it is so critical and so important. And I'm glad that you were able to orient people to the extreme risk for older people. A lot of the climate change narrative has rightfully been around that. And in my presentation today, I would like to talk a bit about how the issue of engagement, of climate change activism and civic engagement actually can be a powerful contributor to longevity in the face of climate change. And so the background that has already been touched on, that aging and climate change represents the longevity challenge of our time, and that older people are certainly the most vulnerable population to climate effects. So we often talk about climate change, or climate change narratives are focused on a distant future, 2050 or our grandchildren, but for older people, the future is now. If people are interested in the Q&A, there's lots of data about how the vulnerability of older people to climate effects is very similar to their extreme vulnerability to COVID-19. However, I'm going to argue that we need to move beyond thinking about how we protect older people to thinking about how we engage them. And clearly, for climate change prevention and mitigation and adaptation, people need to be mobilized. So I think a lot of people would argue that the biggest challenge is how do we mobilize people in general, and especially older people who are somewhat likely to participate. So how do we move older people from being active participants and not just seen as passive victims? You know, borrowing from the disability movement's famous phrase, nothing about us without us, older people need to be involved. And so we need to see older people not just as victims, but as part of the solution to environmental and climate change problems. And we need to embrace the need for their full participation. So I want to touch briefly on what we know about this in a minute or two, and what we need to know, because I know that the ILCs are famous for what we call translational research, bringing research into practical programs and policies. So from a longevity perspective, there is an incredible fit between older people and climate change action. So even in developing countries, in low and middle income countries, retirement's much more common. Older people have discretionary time and resources. And because of our numbers, because I include myself among them now, there's collective impact that's potentially enormous. Also, for those of you in human development, you know that the major developmental task of later life is considered to be generativity. That is, people have a drive to contribute to a world that they themselves may not live to see. So climate change actions is perfect for that. And further, there is a longevity bonus. Volunteering is good for everybody. Research has shown for a half century over the life course. But our research and that of other people shows that there is a bonus to environmental volunteering, that it tends to promote nature exposure and physical activity. And in one longitudinal study we did against other volunteers, people involved in environmental and climate change work actually did even better. There are also immense benefits to communities, and we found this in programs we've done, that older people can, for example, change corporate and government policy, as a famous case in Switzerland, where older people were able to change climate change policy, and older people can serve as sources of hope and of inspiration for younger people. So I'll end with what do we need to know? The one is that there are clear barriers for older people to become engaged on a wide scale in climate change action and sustainability volunteering. They often feel they don't know enough about the area, so we need pathways to increase their knowledge. Many environmental organizations don't adapt activities for different levels of ability. And there is a need to make environmental organizations more age inclusive, which we found that many aren't. And we need to understand what will mobilize older people. Older people do a lot of volunteering and civic engagement, but very little in the environmental field in general. So we need to think of what motivational messages work best. We need to create evidence-based programs to create a pathway, particularly post-retirement, into this. Certainly intergenerational approaches are important. And there is a certain amount of ageism in the climate change movement. I won't say anything about this, but we do have available free of charge an evidence-based program that engages older people. And I thought I had the web address, but if not, people can contact me. It's just, it's called Retirees and Services to the Environment. Sorry, here's the website, but a simple Googling of Retirees and Services to the Environment will find it. And let me conclude with an exciting new development that we've created a hub on this topic, an information hub with information for researchers, including a searchable article database and annotated bibliographies, information for older people about how to become involved, and for organizations about how to involve older people. And we'd love people to feel free to engage with this site and to let us know what they think about it. So thanks, and I'll stop there.
Wonderful. Thank you so much, Carl. I think that point about connectivity and health outcomes for individuals participating is a really crucial point there. But as you say, that your presentation goes beyond particularly the media stereotypes we often see in the UK about older people's involvement in climate change, because we know that often older people are doing the most on this topic comparatively. But they're either presented as renegades in very specific environmental advocacy groups, or this is something that is happening to them. And it's really important to highlight that co-creation and that proactive advocacy that's already happening. We'll just return back to the slides. Bear with me. Wonderful. Thank you so much. So next we have Dr. Maeso Chinseo Lazaro, who is an educator and researcher from the University of Malawi. Maeso holds an interdisciplinary PhD in human geography and social sciences from the University of Hull in the UK, an MSc in family ecology and practice from the University of Alberta in Canada, and a Bachelor of Education in Humanities from the University of Malawi. His research interests revolve around children, youth and families, older persons and aging, and qualitative methodology. So please do take it away.
Thank you so much, Esther and colleagues and all the participants. So I want to talk about climate change, food insecurity, poverty and aging in Malawi. Malawi is in Southern Africa. So I would like to demonstrate an interplay between and among these issues and how they affect aging in Malawi. So I'll explore that interplay by first of all looking at the context of Malawi. Malawi is in Southern Africa. Sometimes it's called in Southeast Africa. But when we talk about food insecurity in Malawi, about a third of the population is currently food insecure. And also that situation is worse for older persons, simply because they have limited means of generating income and also engage in physical activities that may promote agriculture. Malawi is a predominantly poor country with 70% of the population being poor. And as I said, it also affects the older people more than other generations or groups of people because older people did not have stable and viable income that may sustain their livelihoods. In terms of aging, we have seen population aging just like it is happening across the globe. Currently, it's at 5.4%, but it's growing. 10 years back, it was around 3 point something. So it's growing rapidly. The issue of climate change has also impacted livelihoods in Malawi, including older persons. So we see rainfall patterns that have changed. We've seen delayed rains, just like last year we had delayed rains, unpredictable rains, where sometimes we have too many rains, sometimes little rains, which does not sustain agriculture activities. So a lot of what is happening among other persons in Malawi, and I believe in many parts of Southern Africa, is that they are experiencing climate shocks. So for instance, last year we had El Nino, and we had a 17% decrease in maize production. So that affects even food prices. They go up. And also, because of that, we also see an economic decline. So for instance, we have had a 32.3% year-on inflation in April this year. I think it has been revised upwards. It's now around 34.6%. So all these factors or drivers, they have a very big impact on other people in terms of how they age. So in the next slides, I'm going to demonstrate how that is happening. So the major change that is happening is that we have climate change that is affecting livelihoods, especially agriculture. Malawi, by the way, it's a predominantly agriculture nation where over 80% of people depend on agriculture. So anything that goes bad in agriculture affects the entire economy of the country. So because of that, we are seeing economic decline, and that is most prevalent in rural areas. In terms of population, we have more people living in rural areas, about 85%. So it also implies that a bigger number of population of older persons are living in the rural areas. So any impact on livelihoods affect them so much, and the situation worsens because of lack of stable income, age-related health conditions, and also limited options for viable livelihood. So what is happening is that all these factors are playing out, and perhaps are also impacting how older persons live and also age. So I'll go quickly in terms of what can be done at various levels. I'm thinking of awareness. So some of the things are also what Carl pointed out. They are similar. Awareness, because much as there are policies and interventions, they are not normally directing at older persons. It's normally the youth, probably because Malawi is predominantly the youth. So there is also need to deliberately include older persons in climate change and aging agenda. So also in programs, socioeconomic programs, we have them, but they normally don't include older persons. They would target children and women and other poor households. And also perhaps taking it further, a political will in terms of engaging in active policies that would actually support aging well in the midst of all these factors that are affecting older persons. The final one could be advocating at family, community, and national levels about climate change. So educating people about the impact. A lot of people up to now may not know exactly, they may know the rains have changed. By connecting them scientifically to climate change is still an issue, especially when you go to rural areas where illiteracy is a bit high. So basically, these are some of the interventions that I thought could also bring some sort of change in terms of the discourse of climate change and aging. Yeah, so thank you. That's all that I wanted to present. Thank you.
Thank you so much. And to have that context is really important in terms of, particularly for ILC UK sitting here in London, we know there's that asymmetry of nations that are causing climate change, particularly through carbon emissions, and where that impact is currently being felt. As you say, that 80% of people in Malawi are depending on the agricultural industry economically, as well as to meet their nutritional needs. There's a lot that we can be doing collaboratively to move the needle on climate change to, slow that progression. And you've given us some really useful places to start. So thank you so much. Our next speaker is also here with us in the UK to bring in a more industry perspective of what employers and other organisations can be doing to contribute to that collective response to climate change and to longevity. So Nicola Torley is a longevity consultant from Hymans Robertson. She's a consultant specialising in longevity there. She has worked on many different types of projects, from setting baseline mortality and trend assumptions to validating internal models, and has a keen interest in the impact of climate on longevity. Nicola is also one of the hosts of the Hymans Understanding Longevity podcast, which covers a range of topics impacting health, and has recently participated in panel discussions on longevity trends and the influence of AI on health and analytics. So Nicola, the floor is yours.
Thanks, Esther, and thanks very much for having me on the webinar today. So I'll continue the discussion around climate change and longevity, but as you say, I'm going to add an additional consideration to the mix, which is the role of the insurance and pensions industries. And underlying this, I'm going to cover two themes. So firstly, whether any action is being taken to assess the impact of climate change on longevity. And secondly, what else can be done to tackle climate change itself and to help the population age well, even alongside the risks. So with that in mind, let's first consider ways in which insurers and pension schemes and actuaries in general are already measuring and tackling climate change. So if you were to look online, you could easily see that actuaries are problem solvers and strategic thinkers. We use mathematical skills to measure the probability and risk of future events. So those skills, alongside those of others in the finance industry, really are perfect for considering climate change, and they are already being used for that purpose. So I'll start with a couple of leading examples in the insurance space. And some of you might be aware of something called TCFD reports. These are climate-related financial disclosures that some companies are required to make by regulation. They provide information that allows people to assess and price the risks related to climate change, and therefore put an onus on companies to really prove their understanding of how climate change can lead to risks. Another example is scenario analysis. So this is where possible future outcomes can be modelled to assess the impact on, for example, longevity. And in the climate change space, this could mean assessing the impact of different temperature outcomes, a green future, a heat state, or somewhere in between, to see the extremes in life expectancy that could arise under each. And that in turn can raise awareness and understanding around the risks and their possible size and direction. On the pension side, we see schemes driving responsible investment. So this means they are channeling the pension funds into investments that consider environmental, social, and/or governance issues. And this is a really big deal because the size of the funds available for investment, about £2 trillion in the UK, is huge. That can be massively influential in encouraging the growth, or not, of certain industries. And alternatively, some companies may choose to use their voting powers to drive change from the inside, maintaining existing investments, but asking for change in the way that things are done. Now, all of these actions are positive, helping the industry understand the risks of climate change, analyse the potential impact of the risks on longevity, and to try and tackle some of the risks themselves. But despite this, there is a need for more analysis, more action. And yes, the skills are there, but there are limits to data availability and, realistically, the current setup of businesses. A lot of industries are profit focused, and if something isn't known to be material to them, it often falls to the bottom of a long to-do list, which includes other priority items like updates for regulatory change. But as we know, when it comes to climate change, that will probably be leaving it too late. So what else can insurers and pension schemes do? Well, in relation to measuring the impact on longevity, one thought is to join forces with other areas of expertise to really make the most of our analysis and modelling capabilities. Us actuaries have data on a whole range of demographics. We know how longevity is impacted by postcode or socioeconomic status, but it's climate scientists who know the most viable temperature change resulting from a specific climate scenario. When we speak to insurers, a lot of them aren't really sure where to begin when it comes to longevity. Some information suggests there'll be an increase in mortality, others suggest a decrease. So without in-house specialties on climate change, it is understandably hard to decide on a course of action. But combining forces could really alleviate some of that uncertainty. And if we move on from measuring longevity impacts, well, how can insurers and pension schemes either mitigate climate impacts or help the population age well? Let's start with raising awareness, specifically for the general public, rather than the finance industry itself. The Insurance and Pensions Authority, called EIOPA, found that there is a huge protection gap. Only a quarter of total economic losses caused by extreme weather and climate-related events are insured. So either people don't care about the risks of climate change, or more likely, they don't know about them and they can't afford to get cover. Given that insurers have a duty of care to uphold, this seems like a clear call for action to make people aware of what the risks are and how insurance and pensions can help protect against some of the financial downsides. Next up, the industry could enhance product offerings to provide greater coverage of climate risks. Now, there are already products clearly suited for these, for example, flood risk policies, but these could be extended to encourage more sustainable actions. One online suggestion was for greater coverage limits or lower insurance premiums for vehicles that emit lower greenhouse gases. That may incentivize people to switch cars, helping reduce warming, but could also provide cover as the risks continue. Now, one caveat here is the affordability of that option, and we want to ensure that low-income households who can't afford the more sustainable options are not penalised. So maybe some sort of means-tested option should be available, ensuring those who can't afford such cover can get it for a reduced price. Now, there are many other options and solutions available to the industry, but with my time almost up, I do want to finish with one final point. And that's that beneath all the possible solutions, it will be really hard for individual components to change unless entire industries and economies change. I mean, think about it. How can a company reach net zero themselves if they're not in a net zero economy? And realistically, a lot of this change needs mandated from the top through regulations and laws. So having something enforceable could be an underlying key to change. Thanks very much for listening.
Thank you so much, Nicola. And that concept of a net zero economy is absolutely fundamental to all of us, structurally, individually, and in our organizations being able to do more and make more progress more quickly, as we know is necessary. And perhaps the most well-placed individuals to contribute to this would be retired actuaries, who, as you say, have the data analysis and problem-solving skills, and as we heard from Carl, have the time and often the inclination to get involved. So if anyone knows any retired actuaries, maybe maybe reach out and put them in contact with us. In terms of that 2 trillion number that Nicola raised, I think that's a really crucial number for many of us individually to take away from this webinar. I know that friends I have and people in my personal life, we can make changes to any private pensions that we have, and there are options that we as individuals can take to invest in more ethical, more sustainable, and perhaps with lower returns, but there are options available to shift the money that may be sitting in an account, or make these micro changes that are available to all of us if we do take those steps to identify them. So our final, penultimate, speaker we have with us today. We are shifting from a sort of structural economic lens to a sort of health structure lens. So we have with us Dr. Anandita Patnaik from the UK Health Alliance on Climate Change. She is the policy officer there. Anandita is a medical doctor with an MSc in public health from the London School of Hygiene and Tropical Medicine. Prior to moving to the UK, she worked with MSF in a mobile primary healthcare project in a tribal region in central India. She is working towards creating awareness and advocating for climate change and health education for healthcare professionals in India and other low and middle income countries. So Anadita, the floor is yours.
Thank you
I
so
believe
much,
you have some
Esther.
slides to share as well.
Yes, I'll just share it in a moment. So I just wanted to say that it was such an interesting topic to think of, like longevity, like when I was given this topic. So I started thinking about like what we need to have a long life. So we need good health. And then I traced it back to like the WHO, the World Health Organization definition for health, which is physical, mental, and social well-being, and not just the mere absence of disease or infirmity. So, trying to think from that perspective, I was like, to have good physical, mental health, and social health, we need like so many basic things like access to clean water, clean air, and good food, and which is what I wanted to link to climate change in this discussion. So I'll quickly share a couple of slides, which, sorry, so is it visible?
Yes, we can see that. Thank you.
Okay, perfect. So, so to start with, like, so when we talk about planetary health, we sort of think of the health of the planet Earth, the health of all the other living beings other than humans on this earth, as well as human health. So it's a very holistic approach when it comes to health. And as we know, like the World Health Organization has also described the climate crisis as the greatest threat to global health in the 21st century. And the main drivers of climate change, the first one is, of course, fossil fuels, which is leading to the majority of the greenhouse gases and biodiversity loss and driving this whole crisis. But the other important driver of climate change is the food system, which is the agriculture system, which is responsible for 1/3 of global greenhouse gas emissions. And it is the primary driver of biodiversity loss as well. So just looking from the UK perspective, when it comes to the harms of the current food system, and most of these harms can be traced to the global level as well. So the current food system is designed in such a way that it provides us with a lot of calories and leads to a lot of health problems. It's basically we need a transformation in our food system, because there is robust evidence which shows that the planetary health diet, which is basically something that has been endorsed, or which the Eat Lancet Commission has come up with, which says that more than 85% of our plate should consist of different sorts of fruits, vegetables, nuts, legumes, and if we are having any sort of meat or that dairy, it should be less than 15% of the plate. So that's what our plate should look like. And when we have that kind of diet, the planetary boundaries are not exceeded, and we are sticking within the planetary boundaries. And in fact, evidence also shows that 11 million premature deaths could be prevented globally, which means that if we are preventing premature deaths, we are lengthening life, and we are letting people have a good and healthy life. And a very good example of this is from like the blue zones, which are around the world, certain zones where there has been great evidence of people who live more than 100 years. And the common practice is that they eat a diet which is 95 to 100% plant-based. And it shows that how that helps us in living long, healthy lives. So I just wanted to say that, like, transforming a food system in a way where, in a just way, where farmers are on board and the food in schools, public catering, and everywhere is more transition towards a plant-based by default approach would help reduce the greenhouse gas emissions by half, and it could help achieve like the Paris Agreement targets, and it could freeze the global rise of temperature for 30 years. So it's a massive, massive win. If that's one policy recommendation which the UK government and governments around the world should consider, is how to prioritize a plant-based diets amongst its citizens. Somewhat similar to what Denmark has already done. It has a strategy to incorporate plant-based diet. So this, and the maximum benefit can come from this because 90% of these benefits can be achieved by eliminating ruminant animals, which are responsible for non-carbon dioxide greenhouse gases like methane, which causes a significant, which is a very potent greenhouse gas and is responsible for about 30% of the total temperature rise we are facing. And the other point that I would quickly touch is our dependency on motorized traffic. Because apart from eating healthy, we need to exercise well to ensure that we are leading a long and healthy life. So our current road transportation is very much reliant on motorized transport, which is very dependent on fossil fuels, which is driving this planetary health crisis. So sort of the other recommendation that the governments should consider is how to end this dependency on fossil fuels and on cars, and just move towards a cleaner energy system where the built environment is such that it sustains and helps active travel, that is walking, cycling, thrive. Just a small stat that like increasing active travel from 4 minutes to 22 minutes per day can reduce the risk of diabetes and cardiovascular diseases by 14%. And there are also studies which show that if we start using public transport, then we could reach the WHO recommended 150 minutes per week, because like the to and fro from public transport accounts to about 21 minutes per day. So I just wanted to end with those positive notes that government should consider how to transition towards a plant-based diet and reduce the consumption of red meat and dairy, and how to transition transport more towards active travel and public transport, which could help us all lead long, healthy lives. Sorry, I would have spoken more, but I think I'm ending my time here. So thank you so much.
Thank you so much, Anandita. And as you say, you began with the real crux of the issue is that climate change is the greatest threat to global health that we have at the minute. And the responses that we're seeing don't seem to match that level of urgency. I was at an event earlier this year where the head of the World Health Organization and head of the World Bank agreed that if we don't have health, we don't have wealth. And they were talking specifically about health systems funding and how we get money into health systems to enable clinicians to do the jobs that they need to do. But clearly, without planetary health and without all of these resources that we need, the structures that we have are not going to continue to be sustainable. But you gave us some more, you ended on a more positive note than that, which we really appreciate. And thank you so much. I will just share my slides one more time. Bear with me. So, our final speaker this morning, afternoon or evening, depending where you are, is my Global Alliance Climate Change Committee co-chair, Paul, who is also ILC's Head of Partnerships and Programmes. ILC UK's Head of Partnerships and Programmes, to tell a bit more about ILC UK's Global Index, which is a tool that could be a really useful resource for anyone working on climate and looking to use the evidence that we've convened to sort of underpin that conversation. So over to you, Paul.
Thank you, Esther, and hello, everybody. So my slot in this webinar is very much around what can we use in order to make the case for linking longevity and climate change. And here at ILC, one of our flagship projects is our Global Healthy Aging and Prevention Index, which is what we are currently using to examine this issue. Next slide, please. So our index was launched 2.5 years ago, and we rank 153 countries over 6 metrics. So that's health span, lifespan, work span, income, environmental performance, and happiness. As I say, launched it 2.5 years ago, and it has been acknowledged since that launch as being a robust tool. From my end of it, it's great to go to events when actually people turn around and say to me, "Oh, I've seen your index." So we are actually getting some unprompted feedback, which I think is a measure of the work that's been put in behind the dissemination of it, but also the robustness of the model. It's also worth stressing that this is not a name and shame index in any way at all. It's, there are going to be some countries that are doing very well. There are also those who are going to be right down the bottom. But our tone is very much, well, this is where you are. How can you improve? What can we support you with? How do you talk to your neighbours to improve? And indeed, we've had several health and finance ministers coming to us and saying, well, we're number 21, but how can we be number 20? So I think from our end of it, this is a very positive tool to drive the debate on longevity, but also to make those connections with countries who want to do more in the healthy aging space. Next slide, please. So as a background, this slide is showing us 2 things. I think, first of all, that all of the countries on our index are aging at pace. Obviously, within that graph, there are several outliers and different perspectives. For example, Japan and South Korea are aging far faster than other countries. But in essence, we know that the countries we're all globally, we're aging. I think the other thing that this one really pulls out for me is, we're looking at 2040, but we know that we are going to be looking further than that. I think this underlines the message that was picked up on by several of the other speakers, that actually we need to be thinking long term. The actions we take now can't be dictated by the next election cycle. We need to be thinking about the next 10, 15, 20, 40, 50 years. And I think that slide just shows us, if we are going to move any of these lines, particularly those who are lower down on the ranking scale, then we do need to be acting now. Thank you, Esther. So one of the things we had to look at with our index was to look at how the health and the environment and the happiness data that we had works together. Is there a correlation between that? And again, from what you can see there is a real link between those 3 indices, showing that actually, health, environment, and happiness, where those countries who are higher on their index in one of them tend to be higher on the index in the other. So again, it's about how do we use the index to make the case that there is a link there, and a tangible link that we can then take forward to policymakers. Thanks, Esther. So we launched earlier in the year, we launched the second wave of data. So the first, when we launched the index originally, it was largely with pre-COVID data. A few months ago, we launched it with post-COVID data. And so it is good to have a little look at what has happened between 2019 and 2022. Sadly, it is a slightly bleak picture. So less environmentally sustainable, living 8 months less. And I think that key one there about fewer months in good health, because in essence, if we know that we were living longer, the key is to have more of those years and months that are in good health. So a drop in good health within those longer years is not something we really want to see. But again, comparing the data on the pre and post COVID, it will obviously be interesting to update this as we go and see what actually the interaction of COVID with this data was, and whether this is a blip or whether it will uptick again. But in essence, a bit of a bleak picture from the second wave of data that we had. Next slide. However, there were some good outliers that we want to highlight. So Botswana climbed most on our index, up 24 spots. Afghanistan, the biggest improvement in environmental performance. Nepal, biggest increase in lifespan. and Bangladesh, the biggest increase in health span. And of course, the best thing to note about those is that those are all what we call global south, all of those who actually, if we are going to invest in improving longevity in anywhere, these are the sort of countries that we would want to invest in. And actually, it's good to see that the improvement that they are already achieving there. Next slide, please. The other thing that the index is able to do is categorize the 153 countries into various administrative blocks that are used. So we've got the G7, G20, the European Union, BRICS. And the interesting thing on this slide is we can see that there is that link between the income and the environmental performance, which again is something that we, to make the case about how we actually link longevity and environmental performance. This is a very powerful tool on that. Of course, it is interesting to look at that one, the outlier there, which is the community of Latin America and Caribbean states, which have the relatively low income, but then quite high on the environmental performance. So again, as a tool for making the link between longevity and all of its aspects and environmental performance, the index is a very powerful tool in actually bringing that data out and painting the picture right. So I suppose from our end, the next step is actually to be thinking about what the index can then, and this data that we've come can be used for. We are very keen that this index is used more widely. And in terms of the link between longevity and climate change, it is important that we make the case. It is important that the debate is out there. And I think from the way we're using our index to link health and happiness and longevity and income and longevity, it gives us an opening. It starts the debate off, makes the case to governments and businesses that actually you can tackle one and tackle the other at the same time. They're not mutually exclusive. And in fact, the ideal situation, I think this is probably what we'll come on to in our discussion, is how can we improve both so that it is a win-win situation. It's not a mutually exclusive exercise to concentrate on one on the other. We can actually do the 2 + 2 = 5 if we actually consider longevity and climate change together. Thanks, Esther.
Thank you, Paul. I think we're really proud of our index and we're really happy to share it with everyone we can. And obviously the environmental performance metric on there is a really useful tool for this discussion to see where we are. And as Paul noted in his presentation, that transition between 2019 and 2022, obviously those were some tumultuous years. And a lot happened in that time. And the UK, in fact, climbed 2 places between on our index on environmental performance, while still getting worse in real numbers. So we know, as we've noted, collectively, our performance has decreased, and whatever good things we were doing before, we need to start them again or do them better. But it's definitely a really important tool for advocacy and engagement on a holistic view of aging and longevity. So we have some questions for discussion with the panel, and we're also getting some individual questions through the Q&A function. So please do send through any questions you have, and if they are for a specific panelist, we're happy to direct those questions where they need to go. So to begin with, do any of our panelists would have any responses to these questions that maybe you didn't get time to cover in your presentation, in terms of putting longevity and climate on the same agenda? What are the opportunities? What are the opportunities for this year's COP potentially? Do we need a COP for longevity? And how can each sector, industry and organisation take action on both issues in the long term? If there's anything that any of our panelists would like to add, please do jump in.
One question for the other panelists, and if it's not a good one, we can move on to another one. But I really appreciated having people on this panel whose field isn't necessarily longevity and aging, and who are approaching this from a more general perspective. And I was wondering what people think, given the theme, though, of longevity and aging, how much emphasis ought to be put on this interaction of climate change with the older population. On the one hand, I mean, I think the COVID-19 experience is an interesting one where we ignored the extraordinary vulnerability of older people. And in the US, fewer than 3 or 4% of the people who died from COVID-19 were under 50. But we also unleashed a kind of ageism in that, knowing that in almost every disaster between 60 and 100% of the people who die are over the age of 60, and that it's much more harmful for them. I wonder, do we focus on this population? Do we focus more on healthy longevity? What are the pros and cons of taking the kinds of models and measures you're working with and actually focusing on older people specifically? Because given the theme of some of the longevity centers, it's one that we've been struggling with in our work.
Just to feed in with a bit of ILC UK's thinking on this, we'll always advocate for a life course approach to any social or global or policy issue. And sometimes it can be a false dichotomy of choosing a community to focus on, because sometimes it is possible to make interventions or design systems, or I mean, that's the goal, right? It's to design systems that are working for everyone without having to put it bluntly, kind of throw certain groups under the bus to get there. As you pointed out, that's certainly something that we've done, and it's not what we would choose to do again, potentially. So I wonder if any of the other panelists have any reflections on that sort of systemic approach.
Thank you, and I think I'm also going to pick up one of the questions that's appeared in the Q&A about the use of the index in terms of global north and global south. So I think, let's be quite clear, our index is used as a tool for debate. It is not. It is something that we can actually use it to raise the issues. The slides that I presented previously, let's look at Afghanistan having their massive increase in environmental performance. There are going to be reasons, social, economic, political, geographic, why that change has happened. I think very much in terms of focusing on specific regions or specific countries or specific demographics, those are valuable, but they must be seen in the long-term context of us as a global population. So I think that we do take that life course approach. If we start drilling down into specific groups, then I think that is valuable for those groups in themselves. But what we are very much advocating is two things, which is, first of all, a global approach, and secondly, a long-term approach. So it is going to be important. I mean, one of the other, I attended an event recently that was looking at the correlation, or if there was any link between action on climate change and stopping boats coming across the channel into the UK. Now, that discussion tended to be, sadly, it went to focus more on the boats issue than the climate change issue. But I think it's one of those things where when these things come up, let's examine the whole thing in terms of what's happening globally. Now, we know, the sad thing about that is obviously those people who are coming across the channel in those boats, they are going to be obviously in need of what they want to come across here. But what about the ones who are left behind? So I think there's very much an aging in place issue here as well about how climate change can affect geographies, who is left and who is able to move. And unless we actually look at a global perspective on that and then go underneath, then I think that's, we are missing a trick there. Unless we sort out the high level longevity and climate change issues, then actually we're playing catch up with what's going to happen underneath. So that global perspective first, I think, is the important one.
Yeah, and I think I would agree. So global approach is the most important one, but I think with all the subsections, there is an advantage of almost catching people's attention from different angles. Because I think some people will be more interested in, yes, older people, some people will be more interested in the finance side. And actually, when I was thinking about the first discussion point, how can we put it on the same agenda? I was thinking, these webinars and discussions are great, but a lot of them, some people might think are kind of industry focused or kind of quite formal sessions. For me personally, on a sustainability angle, I probably learned the most from myself, from social media, from like TV shows, from books. Are there kind of ways to make the most of those softer kind of not marketing approaches, but ways of making people aware, then we can capture a greater number of people who can gain interest. I mean, the number of times I found out about an issue that I've not read an article, I've not seen it in real life, I've just seen the title pop up so many times. So I think having the variety of where we talk about longevity and climate change and in what context could really help raise awareness.
I agree, and it's that sort of salience point, isn't it, of what's around us and what are we aware of, that allows us to take the first steps perhaps and take the most immediate action that we can in our day-to-day lives, that then hopefully will build and allow us to build networks and you know, collaborate to get a more a broader response to a specific issue. The idea of disposable straws came to mind, you know, when we all banded together and decided straws were no more, and that was marginally successful to some degree. But if the way forward is more straws, more specific issues that we sort of tack onto and all collectively understand we need to behave differently and make different choices and advocate for systemic change on specific things, that can only be a good thing. But Dr. Lazaro, you have your hand up.
Yes, I wanted to say that perhaps we also need to adopt, I'm trying to respond to the first bullet. Perhaps we also need to adopt the strategies or actions based on the context. So, for instance, what would work in the global north may not necessarily work in the global south. In terms of that, I think perhaps in terms of the global south, like in Malawi, we would want to engage the policymakers because I think these are things that are overlooked even at the policy level. So we need to start engaging government and other players at that high level so that they are aware of the interplay of these two things, and also they are aware of how programs and services could target, for instance, older people in the context of climate change. Most of the, like I said in my presentation, most of the programs and services, perhaps the country is overburdened by other challenges. So the focus is normally on children and maternal health and all those things, HIV and all these those things. So perhaps we need to change to start also looking at climate change seriously because of the impact that it has on agriculture, for instance, and the impact that also goes on to the other persons. So I'm thinking directing our attention to policymakers so that changes can be made starting from that level going downwards. An example is the policy that we have, the national policy on older persons. There is hardly a thing about climate change in that policy. So we needed, for instance, to change those documents to start reflecting the impact of climate change. Thank you.
Definitely, and I think there's different ways of making climate change a topic that we just can't avoid. So in the UK, we have a group called Extinction Rebellion that undertake very bold and very controversial actions to bring the public's attention to climate change. And there are obviously similar groups around the world, and they, whether people agree with their methods or not, or however popular they are getting headlines and they are getting that media exposure. But is that translating to the change we want to see? There's some really interesting questions coming through in the Q&A. So I'm going to sort of expand on what Dr. Lazaro was just saying in terms of, do we see a way of capturing public interest, particularly in the global north, and the politicians that have the most can have the most impact here? How do we capture public interest and engaging politicians on both challenges and not seeing them as problems for other people and countries to solve? Carl, your hand flew up.
Just a quick one. I think that is such a good question. And we know, for example, in the United States that around 4% of voters see climate change or environmental issues as their motivation for voting. And that if you look at people's choice of civic engagement and volunteer activities, only about 1% of older people engage in climate change and sustainability, activities. So there is an enormously long way to go. I think one of the things that all of us need to do is partner with organizations and government to really do better research to understand what moves the needle for individuals. For example, I think with older people, public health messaging is more effective than Love Your Earth or sort of Gaia type of messages, that the actual impact on their own health, prompting people's self-interest seems to be better. But honestly, even after, and perhaps other panelists can say, even after many decades of research, we still don't quite know what messaging is best and how to do it. So I think we have a knowledge gap that those of us in academics and in partnership could really address, to try to answer that question, because it's really the most pressing one. How do we get people to become involved and change their behaviors?
I agree. The messaging can make a massive difference to who listens, who responds, who picks up in a certain way. And I mean, this isn't answering the question. I was also thinking something similar from like the finance side, in a kind of not hit them where it hurts, but in a make the messaging important and tell them, things will get more expensive if we don't treat climate change now. It will cost you more in profits or money probably in the future. That sort of messaging might work for some industries, but as you say, other messaging for the general public would be different. And you're right, is it some sort of market research that's needed? It is a hard one because everyone will have a different way of their brain thinking, but I think that's a really important point that you made.
I think
And
another thing
following-
that I have, sorry. I think
No,
another
please
thing
go.
that I have noticed that, like, for example, I'm working in the UK, but I'm originally from India. So in India, like, the effects of climate change are very evident, like, be it heat waves, be it excessive rainfall, flooding, or the other extreme weather events. So it's very like it's tangible and you can see it in front of your eyes. But in the UK, like, if it gets warmer, like the public thinks, oh, like summer, it's better for the summer, like, the temperature actually becomes more pleasant. So it's kind of that gap between like people in the global north being able to understand like what these impacts are. But I've tried to think of like examples of ways in which, like, people could relate to it, like how people in the global north are being impacted by it. For example, it could be small things like, like the prices of olive oil going up. So why has that gone up? Because there was a wildfire in, say, Greece, which is because of the impacts of climate change. So how these, like, sort of connecting all these dots and explaining it to people and raising awareness in ways that they understand. So communicating in a way which is understandable by the communities in different parts of the world. Yeah, that's maybe one approach.
That's really helpful, thank you. And you're right about the olive oil. In fact, that might have been why I'm sat here today. I thought, Paul, we have to put together a committee because the olive oil is too expensive. And in terms of tying these themes together and what next, the sort of messaging points that Carl and Nicola were speaking about earlier, ILC UK have been doing some thinking about with things like COP that are very busy and very, there's a lot of engagement and a lot of discussion. ILC UK pride ourselves as being a positive voice for change. We don't want to just say how rubbish everything is. We want to be a proactive and positive voice. But when we are trying to engage at COP and trying to change minds and change, galvanize action, if we're speaking to the, preaching to the converted, how is the doom and gloom approach going to be the way forward? And can we positively inspire people into doing something that is very complex and very difficult, which is changing our systems to adapt to longevity and climate? We're not saying those are easy things at all. So other panelists' thoughts would be greatly appreciated on that sort of doom and gloom versus positive pragmatism question.
Sorry.
Oh, go ahead.
No, Anna,
No, go
no,
ahead.
you first. No, carry on.
No, so I was just saying that Well, doom and gloom is like fine until a point, but then like people stop like responding to doom and gloom because there's just so much doom and gloom, not just like with the climate crisis, with all the wars happening, with so many other things. So after a certain point, like doom and gloom is not what people want to hear. Rather, like going for like a sort of positive reinforcements and like showing like what actions have been taken successfully and how they've changed. Like one really good example is of how until like the 1970s, even like Amsterdam was like so heavily reliant on motorized transport. Everyone was using cars, but then how they transformed the entire built environment, where now more than 80% of the road transport is by cycling or walking. So like how that has been a successful shift. And similarly, like now I saw a question in the Q&A which was about making veganism mandatory, but to be honest, like that's not a politically feasible policy because it's going to be difficult to implement. Food is very emotive and it's controversial. So, but like a positive example to that would be like, a hospital, all public hospitals in New York are now offering plant-based as a default option in their menus to the patients. And it's not restricting choice because like if someone still wants meat or dairy, they can opt in for that, but the default option is plant-based. So, and it's been a very successful initiative with like patients reporting, more than 90% patients reporting satisfaction. It has reduced cost, it has reduced carbon emissions. So, that's a positive example of how things could potentially be done. Go ahead, Paul, sorry.
Thank you. I'd like just to echo your point about doom and gloom only gets you so far, and I think from our end, certainly from the work Esther and I have been doing with the Climate Change Committee, the Global Alliance, and I think what probably comes back up next after this webinar is how do we suggest those solutions that are going to get that airtime? And I'd just like to pick up on something about the making veganism mandatory. We in ILC UK very much work on this idea of the Overton window, which is that the public debate takes place in quite a narrow field. But if you talk about bits and pieces that are over here, public debates that are over here, even if they are never going to be politically acceptable in the way that mandatory veganism might be, it does actually start dragging the debate in that direction. It gets people thinking about, okay, well, we don't want to do this over here, but we might go halfway. So I think there is something around raising those solutions. I think the other point I wanted to make was about industry, particularly perhaps the financial services industry that I've got some connections with here. So there is an open door there through various ESG initiatives, but I'll bring an example of one of the companies we work with. So Legal & General are a big financial services company in the UK. If you want to work with them in any way, you have to provide them with your environmental policy. You have to prove that actually you are committed to climate change and environmental policies and enacting those. So there is a mood within all industries that actually this is this is a good thing. The door is open. I think how do we then make the case that it will benefit industry as well as the bottom line? It'll be better for their employees and for their customers. And I think the next stage for us is, all right, well, what are those solutions, both in individual countries and in the UK, globally, that we can actually take to them and move that debate and actually move, by connecting longevity and climate change. So make them do some of the work for us as well and get allies in this movement.
Yeah, I just had one small thing to add. I mean, I think the one great thing about this panel that is so helpful is I think we are, talking about these multi-level types of solutions where we need to promote individual behavior change, but also promote policy change. And I think that's true. And I think, I would put in a plug too for coming back to one of Nicola's earlier comments about how we need to communicate in different ways. If you look in the US, climate change denial is on the decline. So more and more people across the political spectrum are accepting that it's occurring. What they are not accepting increasingly is that we can do anything about it. So that they are beginning to accept that it's occurring and it might be human caused, but but also believe that it just is a fact of life that has to be accepted. So I think the kinds of positive stories you're talking, kind of you mentioned, getting the idea that there is hope, there is possible change is really critical. And it's where I'd put in a little plea for really trying to strengthen intergenerational connections around climate change. We're doing a study of older climate change activists who are remarkably hopeful. You know, they've been through crises before, they feel that they've experienced them, they feel that there are the resources to make change. So I think if we could have the climate change movement be somewhat less purely youth focused and really throughout our activities, focus on, I think, what is the theme of the International Longevity Centers, you know, how we connect the generations for productive activity and solutions to social problems. I think right now it's kind of siloed and more youth oriented. And I think that older people have enormous kind of positive, hopeful viewpoints. So I think if we could strive for that, it would link together some of the things we're talking about.
Wonderful. And on that positive call to action, I will just sum up this wonderful discussion we've had. Thank you so much to our panel for your insights and your contributions. It's been really wonderful to have you. Thank you so much to our participants for attending and for contributing to the Q&A and getting involved in the discussion. We've heard some really interesting presentations across a range of topics, setting out why we must consider longevity and climate change as two interrelated and indivisible issues. We know that we need urgent, collaborative and sustained action at the individual and system levels to help us collectively respond to both issues. So we've heard that activism and civic engagement is supportive of longevity outcomes. So if you join the campaign, you'll live longer, and that's a guarantee. We know that awareness raising is fundamental, and then there's lots that all of us can be doing professionally and in our personal lives to change the narrative and sort of bring that message where it currently isn't. We've heard about the role of finance and insurance, health professionals, older adults, and agricultural communities, what's happening and what needs to happen next. And to conclude, we have sort of three key asks following this webinar. The first being, we need to link the two topics in people's minds and build understanding of why we cannot continue to do nothing about longevity and climate change. And when we do act, it cannot be in silos. We need to make the joint economic as well as social case for change. And we need to establish networks and partnerships to move the needle on both topics as one combined topic. So areas of priority would include health, economics, green finance, and housing as examples. So we're delighted that all of you have been able to join us. Please do keep in touch. If you'd like to work with us on these issues and continue the conversation, my email address is currently on the screen. I hope this has been a helpful and useful webinar to shed light on how a lot of these topics intersect and interrelate, and we all have some sort of steps we can do once we get off the webinar to take the conversation forward, galvanize others around us, and hopefully make some real change on longevity and on climate change to see the better outcomes that we know are possible. So thank you to our panel. Thank you, attendees. Thank you so much for joining us, and have a good rest of your day.
Thanks for having
Thank
us.
you so much.
Thanks
Thank
very much.
you.
Thank you.
Thanks,
Thank you so
everybody.
much. Bye.